Today, we're diving into a medical mystery that is genuinely the stuff of nightmares. It's called Creutzfeldt Jakob Disease, or CJD. It's a rare and terrifying condition that challenges everything we think we know about disease, where the brain, quite literally, starts to eat itself. So, let's get into it.
I mean, just read that question. It sounds like the plot of a sci-fi horror movie, doesn't it? But here's the thing. It's not fiction. This is the real, terrifying question at the very heart of CJD. What happens when one of the basic building blocks of your own body goes rogue? It's what makes this disease so incredibly frightening and so profoundly mysterious.
Okay, so before you start to panic, let's get some perspective. This disease is incredibly rare. We're talking about 1 person in a million per year across the entire globe. To put that in perspective, in a country like the United States, that's only about 350 cases a year. So while it's absolutely devastating, your chances of getting it are, thankfully, astronomically low.
All right, so a terrifying brain enigma. What is actually happening inside the brain of someone with CJD? This is where the story goes from scary to downright horrifying, because this destructive process happens with shocking, unbelievable speed.
The damage is described with one perfect word: spongiform. And yeah, it is exactly what it sounds like. If you look at the brain tissue under a microscope, it's filled with these tiny, microscopic holes, so it literally looks like a sponge. This isn't just minor damage. We're talking about the physical evidence of mass neuron death. The brain is literally being destroyed from the inside out.
And the progression of this disease is just brutally fast. It starts out with these really vague symptoms. Things you might just brush off. A little memory trouble, maybe some mood swings. But then it's like a switch flips and it just cascades into total neurological failure. The confusion gets worse and worse, and patients develop these signature involuntary muscle jerks. Eventually, they lose the ability to move or even speak, and it ends in a coma.
And if you want to understand the speed of this decline, just look at this number: 90%. An astonishing 90% of patients die within 1 year of their first symptoms. This isn't a slow, gradual decline. It is a relentless, lightning-fast neurological collapse.
So, what on earth is the culprit here? What's causing all this devastation? You might think it's a virus or a bacteria, something we're familiar with, but it's not. The agent of destruction is something much, much stranger: a rogue protein.
And this rogue protein has a name: a prion. That's short for proteinaceous infectious particle. Now here's the crazy part. A prion is just a misfolded version of a totally normal protein that we all have in our brains right now. But that misfolded shape, it's infectious. And get this, it has no DNA, no RNA, nothing. It's not alive. It's just a shape, a deadly shape that can be passed from one protein to another. This idea completely turned biology upside down.
You can really think of this as Dr. Jekyll and Mr. Hyde. On one side, you've got the normal, healthy protein doing its job, folded correctly. But on the other side, you've got the rogue prion. It's twisted into this rigid, sticky, indestructible shape. Your cells can't break it down, it stops doing its job, and instead becomes this toxic thing that just kills nerve cells.
So how does one bad protein do so much damage? Well, the domino effect is the perfect way to describe it. One rogue prion bumps into a healthy, normal protein. That contact forces the healthy one to instantly misfold into the same bad shape. Now you have 2 bad guys. Then those 2 find 2 more healthy ones. Bam! Now you have 4. You see where this is going. It's an exponential, unstoppable chain reaction that floods the brain with these toxic proteins.
So that begs the question, right? Where does that first bad domino even come from? How does this whole nightmare get started? Well, it turns out there isn't just one answer. There are actually 3 totally different ways this disease can begin.
And when you look at this breakdown, this is what is truly mind-bending. That massive slice of the pie, about 85% of all cases, is what's called sporadic. And that's just a scientific way of saying it happens for no reason we can find. It just appears randomly. A tiny fraction is genetic, and an even tinier slice comes from an outside infection. But the biggest part of this puzzle, it's a complete mystery.
So, let's just lay it out. Sporadic is the big one. It seems to be just cosmic bad luck, where a single protein spontaneously misfolds. Then you have genetic CJD, where a person inherits a mutation that makes their proteins more likely to go rogue. And finally, acquired CJD, which is extremely rare, caused by direct exposure to infected tissue, like through contaminated surgical tools from decades ago.
So, given how rare this is, and how the first symptoms are so vague, You can imagine that actually diagnosing CJD is an enormous challenge. For doctors, it's like trying to find a needle in a haystack, but the haystack is also on fire because everything is moving so incredibly fast.
For a long time, the tests they had just weren't very reliable. You can see here, tests that looked for other proteins in spinal fluid, the accuracy was, not great. But then, look at that first bar. Modern MRI technology was a complete game changer. It can actually see the distinctive damage happening in the brain with almost 100% accuracy, giving doctors a much clearer picture much sooner.
But the biggest breakthrough, the absolute quantum leap, is a test called RT-QIC. And what makes this so incredible is that instead of looking for the damage the prions leave behind, this test detects the killer itself. It can actually find the rogue prion protein in a patient's spinal fluid. This is absolutely revolutionary.
And this quote right here says it all. The test is considered comparable to brain biopsy in terms of accuracy. I mean, just think about that for a second. The old gold standard for a definitive diagnosis was to perform surgery and take a physical piece of the patient's brain. Now, we can get that same level of certainty from a spinal tap. It's just amazing.
Okay, so we've seen what causes it, and we've seen these incredible advances in how to diagnose it, but that brings us to the final and most somber part of this story, the outcome.
Here's the tragic reality. Even with our newfound ability to diagnose CJD with near-perfect accuracy, we still can't stop it. There is no treatment. There is no cure. All that doctors can do is provide supportive and palliative care to keep the patient as comfortable as possible as the disease runs its inevitable, unstoppable course.
4 to 8 months. That's not years. That's the median survival time for the most common form of CJD. It just underscores how unbelievably fast and unforgiving this disease is, leaving families almost no time to even process what's happening.
And so we end up right back where we started, with a profound and unsettling mystery. We know the what, the rogue prion. We know the how, that catastrophic domino effect. But for the vast majority of people who get this disease, we still don't know the why. What is the silent trigger? What's the tiny spark that causes that very first protein to go wrong and set off this fatal cascade? That remains the central, unanswered question.